I'll start going through each product that you use, and so we'll start with Feel Right. How do you use it, and what have you seen by using it?
So Feel Right's one of the first products that we used. We use it in all of our surgeries, all of our bovine surgeries, and we do a fair amount of bovine surgeries. C-sections and GI disturbances and mummified calves and foot surgeries. We do a lot of food animal surgery. And in all of those cases, get a dose of Feel Right prior to or just after the surgery. And the thing that I like about it the most is those cattle stay on feed. They don't ever come off or come out of surgery and don't seem to go back on the feed. And so we have real good success with getting cattle out of surgeries, even major surgeries, and keeping them right on feed, keeping them eating, and keeping them going. So that for us has been the strongest use of the Feel Right is as an appetite stimulant in our stress cattle, as an appetite stimulant in our surgical cases. We use it there and have had very good success with it.
What's like your favorite story about using it?
So the first animal that we used the Feel Right on was a calf that had real severe pneumonia, and he hadn't eaten anything for several days really. He'd been up here, we'd been giving him traditional treatment, antibiotics and anti-inflammatories, but the calf just wouldn't eat. And so we treated him with 4 ounces of Feel Right, and it was like he immediately walked to a feed bunk and put his head in the trough and started eating. And so my first experience with Feel Right has always been my best and my favorite experience with it.
All right, lung score. How do you use it, and what have you seen when using it?
Right. So lung score is another one that we adopted real early on, and we from time to time get into some respiratory train wrecks with some cattle up here. This is wheat pasture country, and we'll have some stockers turned out on wheat pasture. And from time to time, we've gotten into some wrecks with some non-responsive pneumonias or multiple drug-resistant pneumonias. Then we always have the occasional chronic calf that's just sick, and it seems like no matter what you do, they just can't make them better. And in those animals, we utilize the lung score. It's one of our go-to treatments for anything that comes to us that's had any antibiotics prior to being brought to the clinic for a respiratory issue. We just see a reduction in the difficulty that the calves have breathing. So it's got to free up the lungs in some way that allows them just to move air easier in and out of the lungs. And I think that's part of the reason why it's so successful in those chronic lungs that are just scarred and damaged from pneumonias. When we put the Feel Right into those cattle, they just have an easier time of moving air. And most, we've treated lots and lots of cattle that were, pulled and treated 2 and even 3 times with traditional antibiotics, and we still use traditional antibiotics. We just use the lung score in conjunction with that.
What's your favorite story about the lung score?
So it's about the same thing. We had one deal where we got into where it was just a huge, complete train wreck, and we had cattle dying left and right, and were non-responsive to antibiotics. We would run them through the chute early in the morning, and they would have 106, 108 temperatures. Some of them had normal temperatures. It was just all over the place. And so we drenched all those cattle with Feel Right and lung score, and we got them back on the bunk. We just made it easier for them to breathe, and those cattle did remarkably well. They had lung issues. They were always going to have lung issues, but it wasn't nearly as bad as it was prior to the treatments.
Okay, MB1, how do you use it, and what have you seen with it?
So MB1, we use MB1 in kind of a different way than maybe what most people do, and what was put forth as a use of MB1. We use MB1 as an injectable treatment for tumors in large animals. We inject lid lesions on cows. We've injected some sarcoids on some horses and have just had phenomenal success with the product. It's not recommended, it's not pushed, it's not anything else. We've used it in that fashion and we've had really good luck with it. The eye lesions in the cattle, we just inject into the base of the lesion, and it doesn't cure 100% of the cancer eyes. And again, this is the most successful on the lesions that are on the eyelids. It doesn't cure 100%, but it does a very good job at causing those cancerous lesions to actually just core out and fall off. It does the same thing in the sarcoids that we've used it on. Just causes the lesions on the horses to just, they almost dry up and then become porous and then just fall off. And they're multiple injections a week apart. There requires some anesthesia because the immediate injection is painful, but after that they're not. But that's the main way that we've used the MB1, and we've had really good success with it as such.
Have you used it as an antibiotic treatment at all?
Not enough to really tell you about. We've used it in conjunction with the lung score on some real bad pneumonias and things like that, and I don't dislike it for that. I just use it so much more for the injection of the lesions. That's my primary use of it.
And what's your favorite story about MB1? What's the most dramatic thing you've seen?
So the best story we have on the use of the MB1 is, again, injecting it into a tumor or cancerous lesion on a horse. It was an aged mare. She was a brood mare. She wasn't particularly gentle. And the owners weren't interested in spending a whole lot of money on diagnostics to determine what kind of a tumor it was, but to surgically ablate the ear or remove the ear. And so we offered this as an alternative to euthanasia. And so we anesthetized the horse, we injected the base of the lesion, we let her up, we kept her here at the clinic for a week. We laid her down again in a week under anesthesia. We injected the base of the lesion, but that time it was porous. And so when we injected the lesion, there was actually holes where the MB1 leaked out, and that hadn't happened the first time. So we kept her another week. We laid her down again to inject it a third time, and that time when we went to inject the lesion, it slipped off of the ear with a divot where it had been in the skin, and it just wiped away clean. And it was probably the most amazing thing to me. I couldn't believe that it worked the way it worked. Now, we didn't know exactly what kind of cancer it was. It looked similar to a sarcoid. We suspected it was a sarcoid. We've used the product on sarcoids since then with similar success, but that one was by far and away the most dramatic use of the product that we've ever had.
Wow, yeah, that's a pretty cool story. Okay, so then of all the products, if you had to choose just one to use in your practice, which one would it be? Which one is your favorite, and what do you use the most?
So if I had to choose one to use, it'd be the Feel Right, because of the amount of surgeries that we do. We use it on every surgery, and I'm scared to give it up at this point. It's worked so good for so many years.
Okay, and then you would recommend it to anyone that has cattle, horses, these products you've used?
I do, yeah. We recommend them. We use them a lot in the clinic. We send them out with people all the time. I don't think you can go wrong with any of these. Sure, there's cases where anything's not going to work and something would work better and this would do better than that, but for just across the board, these are excellent products, and we recommend them literally every single day. So we are firm believers in the products.
Thank you for your time.
Thank you.